Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. All I perform is cosmetic or aesthetic plastic surgery, and I've been performing those surgeries in the Scottsdale-Paradise Valley area since 1992. I'm very proud in the last couple of years. I've done a lot of research and I've developed a trademark procedure that's proprietary to my practice called a GenXLift. I have a lot of people asking for it, and people want to know, how is a GenXLift performed? A GenXLift is a procedure that has stages of it that basically address that continuum of aging that starts in your 30s and continues through the 50s. And it is for those people that are somewhere in the middle there that may not be ready for a facelift or a full facelift, to find that they can't take the downtime for that, or it may be cost prohibitive for them. So a GenXLift is performed in actually 3 different stages. The first stage is for somebody who's got some mild aging problems, and that is some skin pigmentation problems from sun damage, loss of collagen elasticity, along with loss of volume in their face. You know, it's not surprising that as you age, you really lose that facial volume, so you lose that voluptuousness that you had when you were younger. If I take some fat from one area of your body, I extract it very delicately, spin it in a centrifuge, and then re-inject it in those hollow areas with a very small cannula. Generally it's less than 1 millimeter. I can give you some of that volume back that you had and replenish that voluptuousness that you had when you were younger. So the first stage of GenXLift is actually that laser therapy, which includes a micro laser peel along with profractional laser. That's a 4-day recovery. We call it the 4-day peel, along with some fat transfer. In people that have a little bit more progression of that continuum of aging, where you start to see some laxity of the neck, whether it be loss of jawline or some laxity down along what we call the cervical mental angle, basically I can do something that is relatively non-invasive or non-invasive to give you back some of that definition that you had. And that would be the first 2 procedures, along with something called liposuction, you all know what that is, or possibly ultherapy, or a newer procedure called ThermI-RF, which is actually uses radio frequency and a small catheter that's put below the skin to actually tighten the skin through thermoregulation. What that does is heat up the skin, dissolve some of that fat, and you actually see some of that beautiful definition again. So the stage 2 of the GenXLift is performed again in the office under oral sedation with some pain medication, and involves micro laser peel with a profractional, which is the 4-day peel, fat transfer, along with some kind of modulation to tighten up your neck. In people that have even more advanced aging, that is the definition of loss along the jawline with some jowl formation, cheek laxity, and you're really getting to see more progression of the jowls. I would do the stage 3 of the GenXLift, which is actually a short scar facelift, which actually elevates the deep tissues of the face. I do some fat transfer along with the laser therapy. The beauty of the short scar facelift with the deep tissue elevation is that can be performed in the office under oral sedation with some local anesthesia, with very abbreviated incisions and less scarring. So the incisions generally would be in the sideburn, along the ear, down to the earlobe, so there's nothing behind the ear. It's a very powerful procedure, so I can reinstate that beautiful shape of your face you had when you were younger, elevate the facial fat back where it used to be, and fine-tune with some more fat transfer along with that laser therapy. So all in all, the best way to figure out if you're a candidate for the GenXLift is call for an appointment, get an idea about exactly what's bothering you so we can go through in a mirror and identify your problem points, and bring in some old photos so we have a reference point. Thank you very much.